The Executive Council has asked the Minister of Education to review the directive given to schools over their resumption following the Ebola virus disease. Minister of Health, Professor Onyebuchi said this while giving an update on the handling of the Ebola virus disease to the Council. The Minister of Education, Ibrahim Shekara, will meet with all education commissioners in the country, after which a resumption date will be announced. Professor Chukwu also dispelled the rumors of the spread of the disease in Kaduna, Abuja, Edo, and Calabar, saying that only 2 cases of the Ebola virus disease remain in the country, with one in Lagos and the other in Port Harcourt, Rivers State.
The report of the experts, because the President said we should be reviewing the situation with respect to when schools can reopen as we move along, because it could be dynamic. So the experts were commissioned by the minister to look into it and advise. And they provided that advice to the Minister of Health, who then passed it on to Council. And the Minister of Health informed Council that the expert opinion is that actually schools can resume by any time from the middle of September. But then, in terms of the administrative procedure, the Minister of Education will still have to now re-invite the emergency meeting with all state commissioners for education, using this expert information and other factors, including public holidays, to then inform the nation as to the dates, the actual date of resumption of schools. The number of Ebola virus disease patients currently under treatment, as I speak to you, are 2. 1 in Lagos and 1 in Port Harcourt. The one in Lagos is the wife of the Port Harcourt-based doctor who died from Ebola virus disease. And so he, in turn, infected the wife, who is being treated in Lagos. But the sister of that doctor has also come down with Ebola virus disease, and she's the one being treated in Port Harcourt. So 2 Nigerians are currently under treatment for Ebola virus disease, 1 in Lagos and the other in Port Harcourt. We are still having contacts, either secondary contacts or 3rd-degree contacts, who were placed under surveillance. Those under surveillance, in Lagos, the number has crashed to 41. What it means is that since we started placing people under surveillance in Lagos, 320 persons have been excused or discharged from our surveillance. These 320 people are people who did not come down with any disease after more than 3 weeks. That represents 88% of people who have been placed under surveillance in Lagos who have been let go. That is significant. We are doing well. It's not an easy job. So only 41 presently are under surveillance in Lagos, 41 persons. In Port Harcourt, because we have just started the contact tracing, presently we have 255 persons under surveillance in Port Harcourt. Please disregard all these media rumors and hype. Please disregard. We have a lot of things on the social media. The Nigerian government has been very transparent in this matter, and the media can attest to that. The Minister of Health makes it a point of duty, together with the Minister of Information, to regularly brief the nation. The President, too, has made it a point of duty that is included since the last 4 meetings of FEC as an agenda for the Federal Executive Council to ensure total transparency. Nigeria has been commended by United Nations and also United Nations agency, including WHO and UNICEF, for the transparency.